The last couple of lessons have focused on nutrition, including topics like the Choose My Plate guidelines, serving sizes, food labels, and special dietary needs for teenagers. This lesson will focus on the nutritional needs of teens who have dietary restrictions or circumstances that require them to eat a special diet. One example of a dietary restriction is an allergy to a specific type of food. The most common food allergies include milk, eggs, wheat, seafood, and nuts, especially peanuts. Food-induced allergic reactions can include symptoms such as vomiting or stomach cramps, hives, shortness of breath, wheezing, or coughing, swelling of the lips, tongue, or throat, or anaphylaxis, a potentially deadly reaction in which a person's body goes into shock. The best way to deal with a food allergy once it has been detected is to avoid the food that causes the reaction. Elimination of one or more foods due to allergies can create a nutritional void in a person's diet. But these deficiencies can usually be overcome very easily by substituting a different food that has a similar nutrient value. Another case in which an individual may have to consume a special diet is when they have diabetes. Diabetes is a condition in which a person is unable to control the level of glucose or sugar in their blood. It is caused by problems with the hormone insulin. Insulin is a hormone produced by the pancreas that allows your body to move glucose from the blood into your cells for energy. If you have type 1 diabetes, your body does not produce any insulin at all. This type of diabetes is the one that most often affects children and teenagers. Type 2 diabetes occurs when your body is unable to use the insulin that your pancreas produces. Type 2 diabetes often occurs in people who are overweight or obese, and those who have high blood pressure or high cholesterol. Oftentimes, type 2 diabetes develops in adults. However, with the childhood obesity epidemic in the U.S., more and more cases of type 2 diabetes are being reported in children and teens. Both types of diabetes are controlled with a healthy diet, exercise, oral medications, and insulin injections. If you have diabetes, you will need to monitor your blood sugar level by checking your blood with a finger prick test. You may also need to change your diet by avoiding high-sugar foods and alcohol and limiting fats and oils. When you have diabetes, it's important to eat on a regular schedule and not skip meals. Obesity is an issue that affects many people of all ages, especially in the United States. There is a difference between being overweight and being obese. A person who is overweight weighs more than their ideal body weight, but less than 20% more. A person who is obese weighs more than 20% above their ideal weight. Whether someone is obese or just overweight, a special diet is recommended to bring the weight under control. Most often, healthy food choices and exercise can correct the issue. Basically, in order to lose weight, a person must consume fewer calories than their body uses. Your basal metabolic rate, or BMR, is the number of calories your body uses at rest to perform basic functions like breathing and keeping your heart beating. Your active metabolic rate, or AMR, includes the calories you burn during physical activity like climbing stairs, riding your bike, or mowing the lawn. Calculating your BMR and AMR can help you decide how many calories you should consume in a day if you want to lose weight or just maintain your weight. There are many fitness calculators online that can help you to figure out your BMR and AMR. Although it is not ideal, some teens become pregnant. Pregnancy is a time when special nutritional guidelines should be followed. If you find out that you or someone you know is pregnant, the first step should be seeking early prenatal care from a healthcare provider. Additionally, it's important to maintain good nutrition. A woman who is pregnant will need to consume more calories in order to sustain her growing baby. The expression eating for two might make you think that she should double her food intake, but this is not the case. Most pregnant women need an extra 300 calories in the first trimester, an extra 350 calories during the second trimester, and an extra 500 calories during the third trimester. A healthcare provider, like an OB/GYN, can give specific diet advice for pregnant women. A pregnant woman should make sure she consumes enough protein, calcium, iron, and folic acid. Increasing consumption of foods in the protein and dairy groups should help, but a prenatal vitamin might also be recommended by a doctor. When a woman becomes pregnant, she will also need to increase the amount of fluids she drinks to support her growing blood volume and the increasing amniotic fluid surrounding the baby. It's important that a pregnant woman chooses the right fluids, however. Alcoholic beverages should be completely avoided during pregnancy because they could result in premature delivery or fetal alcohol syndrome, a condition in which the baby is born with IQ damage and mental retardation. Caffeinated beverages are also not recommended because they can lead to dehydration and an increased heart rate and blood pressure, things that are not good for the mother or the developing baby. Finally, the pregnant woman should not take any drugs, including over-the-counter medicines, without a doctor's approval. Some medicines and prescriptions can be extremely harmful to the baby's development and even lead to birth defects or miscarriage. Obviously, illegal drugs are harmful to both mother and baby and should not be taken. The last example of a special diet is vegetarianism. Many teens decide for various reasons to eliminate or reduce animal products in their diet. Lacto-vegetarians do not eat meat, but do eat dairy. Ovo-vegetarians consume eggs, but not meat or dairy. Lacto-ovo-vegetarians eat eggs and dairy, but no meat. Semi-vegetarians eat eggs, dairy, fish, and maybe chicken, but no other meats. Vegans do not eat any animal products at all. Eliminating or reducing meat, eggs, and dairy products in your diet can leave some crucial deficits in your nutrition. It is therefore important to pay extra attention to certain nutrients like protein, calcium, and iron if you are following a vegetarian diet. Plenty of plant-based foods offer these nutrients, for example, beans and dark green leafy vegetables. Dietary supplements like vitamins can also help to get complete nutrition. Vegetarianism can be a very healthy lifestyle choice, but it does take some extra research to make sure you are satisfying your nutrition and caloric requirements. Talking to a doctor or dietitian can help you design a healthy vegetarian diet. Nutrition can be a very tricky subject, especially when you are a teenager with dietary restrictions or special circumstances that require a specific diet. Hopefully, after completing this lesson, you will feel more informed about nutrition and more empowered to make personalized decisions for a healthy diet.